Afternoon. Thank you for being here. This is the regularly scheduled meeting of the Public Safety, Civil Rights, and Emergency Management Committee. My name is Blong Yang. I'm the chair of this committee, and with me today are Council Members Palmisano, Council Member Quincy, and Council President Johnson. And I believe Council Member Reich is out for city business today, and Council Member Gordon may be joining us shortly. We are a quorum of this committee, and we can conduct this committee's business. And so with that, we have an agenda that has 6 items. 3 items are consent items and 3 items are discussion items. And we will address the consent items first. And then we will go on to the discussion items as listed. So item number 1 is a revised comprehensive general emergency management plan, and it's a passage of resolution approving the revised emergency operations plan version winter 2016 pursuant to Minneapolis Code of Ordinance Title 6 section 128.20. Item number 2 is authorizing an individual agency joint powers agreement with the Minnesota State Patrol, Hennepin County Sheriff's Office, Metro Transit Law Enforcement Services under the Police 2017 Safety Initiates Joint Enforcement Teams patrols for the period of May 26th through September 2nd, 2017, with each agreement in the amount of $20,000 for a total cost of $60,000 for additional law enforcement personnel in high crime areas within the 4th precinct, and it will be referred to Ways and Means. The third item is authorizing the Minneapolis Police Department to enter into an agreement with other law enforcement agencies to provide law enforcement officers to meet the public safety needs during 2018's Super Bowl events from January 26th through February 5th, 2018, and to establish the reimbursement rates and related terms for these services, which will be reimbursed by the 2018 Super Bowl Host Committee, and this will be referred to Ways and Means. The discussion items, I will be quick about them. We have a discussion item with regards to the co-responder pilot program. Fifth item is Office of Police Conduct Review 2016 Annual Report, and the 6th item is the collaborative public safety strategies, and this is for the $500,000 that was for Little Earth and West Broadway, North Minneapolis. And so we'll have a presentation and also questions from my colleagues here. So with that, council members, anyone have, we're going to address the consent items. Anyone want to pull anything off for discussion? All right, seeing none, I will move all 3 items for approval. Is there any discussion on them? Seeing none, all those in favor, please say aye. Aye. Any opposed? Motion carries. All right, we will address item number 4, which is the contract with Hennepin County Community Outreach for Co-Responder Pilot Program. And with us today is Inspector Kathy Waite, and she's going to give us a short presentation. And then if any council members have any questions, please feel free. Inspector Waite, welcome.
Thank you, sir. So the Police Conduct and Oversight Commission conducted research and did a study to provide us with information regarding co-responder models. They suggested the Minneapolis Police Department move forward with that, and so we are doing so. With that, we are planning on having the officers work Monday through Friday from 10 o'clock in the morning till 6 o'clock at night. They will be designated to be working in the 3rd and the 5th precinct. It's been decided that they work in a smaller geographic area initially as part of this pilot so that we can do more study and analysis on a smaller geographic area. In addition to that, the 3rd precinct and the 5th precinct combined has the highest volume of calls involving people that are suffering from emotionally disturbed situations and mental health crises. So we want to be able to be responsive to that community. In addition to that, we also house a number of facilities in both precincts where there are people receiving additional resources as they move through healing process through the crises. In addition to that, it's important to note that the co-responder really works towards the goals of keeping people out of the jail system and the hospital system. So with the co-responder model, the officer would be paired with a mental health provider for their entire shift. They would be responding to 911 calls for service involving clients or customers that are in need of mental health assistance that are currently experiencing a crisis. So the co-responder team would be the secondary squad to the call. There would be a primary 911 response to the call, and this team would act as a secondary response. Once the scene is deemed safe or code 4, this team would move in and be able to provide additional resources to the patient. So they'd be able to do a lot of additional de-escalation. They could do an on-scene assessment, which actually takes anywhere from 2 to 3 hours. Having the team together, they can work through any problems that they're experiencing, try to problem solve for long-term solutions. And in addition to hopefully avoiding jail or hospital, there's now going to be an additional service provided at 1800 Chicago. So in working with COPE, which would be the designated mental health provider that the officers would be working with, we would be able to utilize that 1800 Chicago as an additional resource as well. In addition to that, responding to 911 calls, they would also be able to respond to locations where we perhaps have a higher volume of calls involving clients that are suffering from mental illness. So whether it's a geographic area or perhaps it's an actual facility that could use some additional support from our team, that would be our goal, to help reduce those call volumes to some of those locations. In addition, perhaps there's a patient out there that needs some additional support or follow-up care. So whether it's a call, 911 call that we had gone on prior to that time, and we can do follow-up to make sure that they're receiving the services that they need, or perhaps it's a follow-up because of maybe a community member has requested us to do that, or perhaps a care provider. So this would be another opportunity for this team to go out and be responsive to the needs of the community and spend additional time with patients and clients that really would benefit from a problem-solving technique, rather than just going out doing the best they can as patrol officers and then having to move on to the next call. This team can really spend a significant amount of time to address the issues that people are facing. I will be happy to take questions. I've got a lot of material here, so I could stand here for several hours if you wanted me to, but I'll be considerate of your time.
Thank you very much, and it's great to see you and great to hear about this effort moving forward. I just want to be clear because we have 3 officers and 2 mental health professionals.
Yes, sir.
So that doesn't necessarily add up to 2 teams, but the way that I understand it, there'll be one team stationed at the 3rd precinct and another at the 5th precinct?
Right now, they're all going to be stationed out of the 5th precinct,
Okay.
but they'll be responsive to calls in both of those precincts. So
I see.
they will go out to both locations. Yes,
And-
sir.
And so we'll have one team staffed at a time?
Um, you know, the plan is that they all work Monday through Friday. So there'd be 2 teams working simultaneously. But we have to factor in training time, vacation time, and the like. And so there may only be one team working on any given day. In addition, with some of the training that we've got coming up, we've got a lot of extensive training for our officers this coming year. So having the 3rd officer will afford us the opportunity to make sure that we do have a team out available on the streets every day. In addition to that, there is some research piece that needs to be conducted by the officers as well, so that if there is a day when all 3 officers are working, they can do some of this research to determine, is there a location we need to be spending more time at? Is there perhaps a social service agency that we should be pairing with and maybe conducting a meeting with to see what more we can do for them, and vice versa? So that person's day will definitely be filled with plenty of opportunities for outreach as well.
And this is a 1-year contract?
Yes, sir.
And it starts once this is approved?
That's correct.
And so it would go
Right.
till next
Right.
April or May?
Well, we're hoping as soon as this contract gets complete and we have got the officers in place, that we'll be able to move forward. So we've got a job announcement out right now, and officers are putting in the application for the position.
Okay, wonderful. I guess my other main question is, when will we hear back, or maybe just a discussion point? Because I would like to think we're approaching this, we're starting it now. We have some goals in mind that we want to be able to measure our success up against, and how well are we going to be tracking those goals,
Right.
and when are we going to hear what worked, what didn't work, so we can start deciding whether we want to expand the pilot or, and that's
Definitely.
what I'm hoping we'll look at, or maybe how we need to correct some things before we move forward.
Right. So that was page 3.
Okay.
So, good questions. We do have goals in mind and some metrics that we will be following. Again, having that third officer in place, that will be part of their job, is to collect data from each day so that we can determine, is it helpful to be doing this? Do we need to expand it? Maybe we need to shrink it. Maybe we need to have a smaller initial footprint for the pilot. So we'll be doing analysis on a weekly basis to see what's working and what isn't. And maybe there are things that we hadn't even considered yet that we really need to factor in as part of this pilot project. So we want to make sure we're staying on top of that on a weekly basis. I'm afraid if we let it go even quarterly, that we'll lose steam perhaps, or we'll be omitting things that we shouldn't. So we're really going to be staying on top of the goals and metrics so that we can be responsive to the needs of the community and to the goals of the project.
So, Mr. Chair, then I'm wondering, would you think that we'd be prepared to have a report or some results back in 4 months, or
Absolutely.
because I think that would really be useful to hear about it
Yeah.
again, maybe even before we approve next year's budget, because this could easily have some budget implications. And then I guess my last question is there a more defined plan or outline of what's happening online? I know you talked about your 3-page, or I don't know how many pages you have. And if that was something that could be shared with committee members, that might be useful to kind of see those kind of details, or maybe it's already available online.
Sure. Not to my knowledge, it is not online, but it certainly is something that we could do.
Okay, thank you.
Council President Johnson?
Thank you, Mr. Chair. Inspector, what will these police officers that are assigned to this receive any more training than our typical officer that gets the 40 hours of crisis intervention training? Is it a stepped up crisis training or psychiatric training?
You know, it's something that we would like to have them achieve.
Mm-hmm.
Right now, there's not training out there on how to be
Okay.
a co-responder,
Uh-huh.
and that's the trouble. Our plan right now is to have them do some on-site assessments with Duluth Police Department, because they currently
Right.
have this
Mhm.
program already in
Mhm.
place, scaled down, of course, but it's been something that they've been doing for a year now. So it'd be nice for them to go up there along with
Mhm.
the mental health professionals too, so that they can see what it
Mhm.
looks like.
Mhm.
And we would also have that opportunity to do that in over in Wisconsin, because they've got programs over in Wisconsin as well that we could pattern this after.
Mm.
So I thought, well, that would be a viable option for them
Mhm.
at this time. We've had the training unit do some work trying to find programs that are
Mhm.
available to them, and
Mhm.
there's just really, there's nothing local.
Hmm.
So we're gonna,
Hmm.
maybe we could do that in the future.
Yeah.
So
Okay. I'm just, I'm curious as to Hennepin County right now has this psychiatric emergencies team that goes out probably more to group homes and those sorts of things. Am I
is it the
wrong?
COPE teams?
Yeah.
Yes. Yep.
Okay.
So that's who we'd
Okay.
actually be partnered with.
Right. Right. Okay. And that is out of the Crisis Intervention Center or the Hennepin County's.
It's out of Hennepin County. It is
Okay.
a 24/7
Yeah. Okay.
program that they
Okay.
provide that goes out
Right.
into the community.
Right. Right. Okay. So I guess my question is, if we're going to be, if it's a police 911 call, we're sending a squad there already, that hopefully those officers have been trained in mental health crisis intervention training. They've had their 40 hours. And now we're going to send this other team out there too.
Mhm.
And I think it would be important that that other team, the second team, have perhaps a stepped up psychiatric training, because I mean, I guess what I'm saying is I'm not seeing what we're adding to the situation
Sure.
with this, unless there's
Mhm.
some kind of added value
Right.
of having people having more intense training.
So what we bring to the table with this team is that mental health professional,
Hmm.
and having them.
But they would be called anyway, correct?
No, they would not. Generally, officers, when they respond to EDP calls, they do not call out COPE.
Okay,
COPE might respond on their own,
I
but
see.
we do
Okay.
not generally respond to anything in tandem unless they've already responded and are requesting police
Gotcha.
services.
Okay.
So that would be the
That's
benefit.
very helpful then. Okay, I understand now. All right. I think it's it's a great concept, and it's like our pilot on the north side where we have a heavy domestic abuse call load, and I can understand in South Minneapolis that was the place. It is the place where there's a lot of group homes and um, housing for people with mental illness, more than on the north side. So this makes a lot of sense. So I'm glad I understand it better. And I did hear, actually, one of my children told me that the Duluth model has worked really well. They're very, very happy with how that's worked up there. And so I'm glad to hear that we're not trying to reinvent the wheel, go find out what they're doing and see how that works. So thank you.
Thank you, ma'am.
Any other questions, comments? Inspector Wade, thank you. And let me just mention that Councilmember Gordon had mentioned part about reporting back in 4 to 6 months, and I'm going to put the onus on Councilmember Gordon to remember that. So if he brings it up, then I will let you or somebody within MPD know that that's the case. But there's no staff direction before us, and so we'll just keep that as a mental note. Councilmember Gordon, if you can remember that, that would be wonderful. So Inspector Wade, thank you.
Thank you very much.
We'll see. So with that discussion item completed, I will move item number 4 for approval. Any discussion? All right. And Council President Johnson, you have your.
Oh, I'm sorry.
Okay. All right. Seeing none, all those in favor, please say aye.
Aye.
Any opposed? All right. The motion carries. Thank you. We are on to item number 5, which is receiving and filing the Office of Police Conduct Review Annual Report. And so please come on up, and if you both can introduce yourselves and then just go on with the presentation. We had allotted 20 minutes for this presentation, and then we'll go to questions afterwards.
Good afternoon, Chair Yang, Council President Johnson, council members. My name is Imani Jafar. I'm the Director of the Office of Police Conduct Review, and I will be presenting the 2016 annual report to you this afternoon. I'm going to present the majority of the report. Towards the end, I will ask OPCR's legal analyst Ryan Patrick to talk about the work with the Police Conduct Oversight Commission. I also wanted to note that Lieutenant Henry Halverson from Internal Affairs is attending with us here today. So we wanted to start today's presentation with the technological advancements. I know that last year when we did our annual report, we kind of gave a preview of some of the things we hope to achieve. We're happy to report that we have made great strides on the technological front. What you see here in the first slide is actually a screenshot of the public data portal that has been launched. So people in Minneapolis can now access police misconduct data at their fingertips that is automatically updated every 2 weeks. You can see there's several dashboards up there. All of the data that we will be presenting to you today is what appears on the website as well. Just to give you an idea of the impact this has had, when we had static quarterly reports, 10 to 15 people viewed those reports. Since the launch of the public data portal, 5,413 people have viewed the Office of Police Conduct's data. An additional 4,400 have viewed the public profile card finder, which is where you can type in an officer's name and see their misconduct history. So it really has had quite a big impact. So for today's presentation, we've isolated the data to 2016, but if you go on the website, you can actually get data from the inception of OPCR in 2012. So the first data point here is the total complaints. We've broken them out into 2 categories for you. The blue line, which are complaints within our jurisdiction. Office of Police Conduct Review can handle complaints against Minneapolis police officers. Our agency does get complaints against Metro Transit, Park Police, and other agencies, even people out of state. We cannot handle those. However, they are still screened by our intake investigator, and they're still handled at our case intake every week with the joint supervisors. So a designee from Internal Affairs, usually Lieutenant Halverson and myself, will still dedicate staff time to going through those complaints. So even though they're out of jurisdiction, they have a lot of people looking at them. So in total, Office of Police Conduct Review received 370 complaints last year, 148 were outside the jurisdiction. And on the right side, you can see the complaints broken out by precinct. Now, the next point here are the joint supervisor decisions. And I have 2 slides here so you can kind of see how the cases are being routed once we have had a chance to consider them. So within jurisdiction, we're looking at 222 cases. As I mentioned before, the joint supervisors, myself, and a designee from internal affairs will look at those cases weekly. One interesting point in 2016 to note is that body cameras have changed that review a little bit. Now we have body camera on the vast majority of cases. It really helps us make a more accurate assessment at the outset because you can actually see the interaction, compare it to the complaint, and make what we feel is a good route for the case to go on. So in 2016, 78 cases were routed to investigation. 41 were sent to coaching, which is performance mentoring, where you have to sit down with your supervisor. We actually review all of the coaching documents that come back to us to make sure that the officer was actually talked to about the issue. When complaints go through to investigation, when the complainant files that complaint, they have a choice of a civilian or a sworn investigator or no preference. The vast amount of complainants say they do not have a preference, but the ones who do indicate that they'd like a civilian investigator, we have 2 case investigators on staff and 1 intake investigator who assists with investigations as well. There are currently a capacity for 9 sworn investigators through internal affairs. Both of those groups investigate Office of Police Conduct Review cases, and I'm happy to report so far we've been able to accommodate all requests. Now, on the next slide, you'll see the actual allegation breakdown. So you'll see what's happening to